Hello everyone, now let us discuss about CPT guidelines for surgery digestive system. In the current session, we will be discussing briefly regarding the important points to be remembered with examples. For detailed description of CPTs, you can refer other videos. Now, before coding any procedure, first you need to find out the way how that particular abnormality is treated. And there are three different ways a physician can treat an abnormality. It can be through open incision or through endoscopy or through laparoscopy. Open incision is nothing but here an incision is made to a particular organ for the visualization of the body part, exposing the body part. This is nothing but open procedure. This is very invasive and nowadays majorly laparoscopic procedures are performed. Next, coming to endoscopy. Endoscopy is not, endo means within, scopy is visual examination. Whenever we code endoscopy, you need to take into consideration the type of scope, whether it is flexible or rigid, and route of administration, whether it is oral, nasal, or through artificial opening, that is stoma. Next, coming to laparoscopy. Laparo means abdomen. Scope is the instrument used to examine, and scopy is nothing but visual examination. And laparoscopic procedures are minimal invasive procedures. Here, two small ports or two small incisions are made through abdomen and the particular organ is visualized. The key terms that we must look when we are coding laparoscopy are ports, whether it is robotic assisted endoscopic procedure or lap band, etc. Now coming to the points to be considered while coding for endoscopy procedures. First of all, you need to look for the name of the procedure. In the description itself, name of the procedure will be given. For example, esophagoscopy, colonoscopy, EGD, ERCP, sigmoidoscopy, proctosigmoidoscopy, anoscopy, etc. If a procedure name is not documented, whenever the procedure name is not documented, the extent of the scope, that is until which site that scope has been administered, the extent of the scope will be the name of the procedure, will be the governing factor in deciding the name of the procedure. Next thing is you need to check the purpose or the intent of the procedure. Majorly there can be two types. It can be diagnostic or therapeutic. Diagnostic is for preventive purposes and therapeutic is to treat any particular disease or disorder, diseased state. So you need to check the purpose or the intent of the procedure. Diagnostic procedure to find out the abnormality or therapeutic procedure in order to treat particular abnormality. A diagnostic procedure followed by therapeutic procedure. Whenever a patient presents for diagnostic procedure, but physician finds out an abnormality and performs the treatment of that particular procedure. Whenever both diagnostic and therapeutic endoscopy are performed, you need to code only therapeutic endoscopy. That is important point. Diagnostic endoscopy is included in the treatment. And by using a scope, physician performs more than one treatment. If by using a scope of if a physician performs more than one treatment, you need to code each treatment. These two are the important points. Whether you need, first of all, you need to look for whether it is diagnostic or therapeutic. Whenever both diagnostic and therapeutic are performed, you need to code only therapeutic. And if more than one treatment, the same scope is used to perform more than one treatment, you need to code each treatment separately. Now, here you can see some of the definitions. Proctosigmoidoscopy. Proctosigmoidoscopy is nothing but visual examination from anus to sigmoid colon. From anus to sigmoid colon is nothing but proctosigmoidoscopy. Next, if the examination is performed from anus to behind the splenic fissure, from anus to behind the splenic fissure, then it is called as sigmoidoscopy. So the extent of the scope determines the name of the procedure. Now let us take some random examples from various topics and discuss those particular CPTs. First of all, coming to the first example, What is the CPT code for the creation of an opening into a stomach to insert a feeding tube? For nutrition support for an adult patient with proximal esophageal carcinoma due to alcohol dependence, a gastric tube was not created. Whenever we code any procedure, first you need to look for the key terms and you need to be quick. Here, creation of an opening into the stomach, that is nothing but gastrostomy. Ostomy means artificial opening for the insertion of a feeding tube. So if you go for, there are two methods. Directly you can, 4 CPTs will be given in the options. You can directly search each CPT or you can go to the index and search for the key term. Here insertion is the key term. Under insertion you can find feeding tube. There you can find the respective CPT. Here we are not discussing like that. We are directly going to the CPT description. Insertion of a feeding tube. If you look for 43830, you can find gastrostomy open without construction of gastric tube. Here you can see a gastric tube was not constructed. So you need to code without construction of gastric tube. So the correct CPT for this thing is insertion of a feeding tube for the nutrition of an adult with proximal esophageal carcinoma without construction of a gastric tube is 43830. Next example, a patient presents with a 2 cm benign lip lesion. The physician decides to remove the lesion with a portion of the lip by performing a wedge resection. Here, the lesion is removed along with the excision of lip. Excision is nothing but removal. Excision of a portion of the lip with the wedge excision. The type of excision is wedge excision. And a single layer closure repair is performed. What is the particular CPT? Under excision of lip, you can find 40510. Excision of lip, transverse wedge excision with primary closure because it is a single layered closure. The correct CPT is 40510. Now let us see one more example. 25-year-old patient had symptoms of right lower quadrant abdominal pain, fever, vomiting and was diagnosed with acute appendicitis. The surgeon makes an abdominal incision to remove the appendix. Here incision is made and it is an open procedure, not laparoscopical. Appendix was not ruptured and incision was closed. What are the correct CPTs? Under excision you can find 44950. That is nothing but appendectomy. If it is ruptured, here you can see appendix was not ruptured. If in case appendix was ruptured with abscess or generalized peritonitis, you need to code 44960. Since appendix is not ruptured, you need to, the correct code is 44950. Now let us see one more example. 20-year-old presents with a history of bloody stools for 3 weeks. Duration. The patient was prepped for sigmoidoscopy. The sigmoidoscope was passed without difficulty to about 40 centimeters. The entire mucous lining was erythematous. There were no febrility, no bleeding, no pseudopolyps were noted and biopsies were taken at about 30 centimeters. The scope retracted, no other abnormalities were noted. Here sigmoidoscopy is performed along with the biopsy. Sigmoidoscopy is nothing but examination of the entire rectum, sigmoid colon and may include the examination of portion of descending colon. So under sigmoidoscopy, if you see 45330, it is nothing but sigmoidoscopy flexible diagnostic including collection of specimen with the biopsy. Under it 45331 is the correct answer because here the complete description of 45331 is sigmoidoscopy with biopsy, single or multiple. Here biopsies are performed, that is nothing but multiple biopsies. So whether it is single or multiple, if biopsy is performed along with sigmoidoscopy, the CPT is 45331. Next example, a 4-year-old accidentally ingests Valium found in the mother's purse and is found unconscious and was rushed to emergency department, ED. The child is treated by inserting a tube orally down to the stomach and performing a gastric lavage, removing the stomach contents. Insertion of tube is nothing but intubation. Insertion of tube orally down to the stomach and along with it gastric lavage is performed. So the correct CPT is 43753. If you see the description of 43753, you can find gastric intubation and aspiration therapeutic necessitating physician skill, that is for gastrointestinal hemorrhage, including lavage if performed. Next question is, how do you report a screening colonoscopy performed on 65-year-old patient with family history of colon cancer? The physician is able to pass the scope up to cecum. CPT codes for this encounter are 45378. Patient presents for diagnostic colonoscopy. A colonoscope is inserted in the anus and moved through the colon to the cecum in order to visualize the lumen of the rectum and colon. That is nothing but colonoscopy. If a colonoscope is inserted in the anus and moved through the colon to cecum in order to visualize the lumen of the rectum and colon, that is colonoscopy. The correct CPT for diagnostic colonoscopy is 45378. Next important topic in the digestive system is tonsillectomy and adenoidectomy. Whenever we are going tonsillectomy and adenoidectomy, you need to look for the age of the patient and whether the primary means initial removal, whether the procedure is primary or secondary. Primary means initial removal, secondary means subsequent removal. These two are the points that must be taken into consideration while coding tonsillectomy and adenoidectomy. Let us see examples. 7-year-old girl presents to the same day surgery unit for tonsillectomy, and during the surgery the physician notices adenoids are inflamed and must be taken out as well. So here the patient presents for tonsillectomy. Ectomy means nothing but surgical removal. Tonsillectomy is surgical removal of tonsils. Presents for tonsillectomy, and during this surgery the physician notices that adenoids are also swollen. So subsequently adenoidectomy is also performed. So the code for both tonsillectomy and adenoidectomy, and the patient is 7 years, that is younger than 12 years of age. The correct CPT is 42820. Tonsillectomy and adenoidectomy younger than age 12. Coming to next question, 12-year-old had an adenoidectomy in 2014. That is primary adenoidectomy is also already performed and now presents for second adenoidectomy now. What is the CPT code for secondary adenoidectomy? Under adenoidectomy, you can find there is separate code for primary and separate code for secondary. Here, patient is 12 years old and adenoidectomy is performed. Secondary adenoidectomy is performed. So for secondary adenoidectomy and the age is 12 years or over, the correct CPT is 42836. Next important topic is hernia. Whenever we are coding hernia, you need to identify the type of the hernia based on its location, whether it is inguinal, incisional, etc. Next, type of the procedure performed for the hernia repair, whether it is open procedure or laparoscopy. Next, age of the patient must be taken into consideration, whether the hernia is initial or recurrent, and also the clinical presentation of the hernia is also important while coding. Next is clinical presentation is nothing but whether it is incarcerated or reducible. And finally, the diameter or the length must be taken into consideration. These are the points that must be taken into consideration whenever we code hernia. Now let us see an example. A 30-year-old came to the clinic for recurrent incarcerated incisional hernia repair. Laparoscopy is performed by using mesh. the length of defects is less than 3 centimeters. Repair of recurrent incarcerated incisional hernia. If you see the CPT description of 49613, you can find repair of anterior abdominal hernia. It can be epigastric, incisional, ventral, umbilical and Spigelian. Any approach, whether it can be open, laparoscopy or robotic. Recurrent. Repair of anterior abdominal hernia recurrent, including the implantation of mesh or other processes when performed, and total length of the defect is less than 3 centimeters and it is reducible. In our case, the hernia is incarcerated. It is a recurrent incarcerated incisional hernia. Incisional is a type of abdominal hernia. So under it, and the length of the defect is less than 3 centimeters. So the correct CPT is 49614. Repair of anterior incisional hernia recurrent and the length of the defect is less than 3 centimeters, incarcerated or strangulated. Here it is incarcerated. So the correct CPT is 49614. Now let us see one more example. A 5-year-old admitted to hospital for reducible initial inguinal hernia repair. It is primary repair. Initial inguinal hernia repair and the age of the patient is 5 years. So you can find under 49500, it indicates description. Repair initial inguinal hernia age 6 months to younger than 5 years. With or without hydrocelectomy, reducible. Here in our case the patient is 5 years of age. So the correct CPT is 49505. Repair initial inguinal hernia age 5 years or older, reducible. This is reducible initial inguinal hernia repair. So the correct CPT is 49505. Here you can see hemorrhoids are developed in the anus. Internal prolapsed hemorrhoid columns. These are the internal prolapsed hemorrhoid columns. The image is not clear because this is a black and white one. Please bear with it. Anal column is considered to be an internal hemorrhoid with 3 major areas in the anal canal. The 3 major areas are right posterior, that is 1 o'clock, right anterior, that is 5 o'clock, and left lateral, that is 9 o'clock position of the anus. And the treatment can be done by using rubber band ligation or other than rubber band ligation. Let us see one more question. If a perianal abscess is identified and incised and drained during the course of performing internal and external hemorrhoidectomy. Here the physician is initially performing internal and external hemorrhoidectomy, and during that procedure a perianal abscess incision and drainage is also performed. So here you need to report 2 CPTs. First is 46255 to indicate hemorrhoidectomy internal and external, single column or group. Additionally, 46050 is also reported along with 51 modifier. 46050 is reported to indicate incision and drainage, perianal abscess, superficial. Now let us see one more question. A patient came for hemorrhoidectomy with the fissurectomy, internal and external, for 2 columns. Here, hemorrhoidectomy, both internal, external, 2 columns, along with fissurectomy is performed. So the correct CPT is 46261. If you see the description of 46260, it indicates hemorrhoidectomy, internal and external, 2 or more columns or groups. In our case, it is 2 columns and it is performed along with fissurectomy. So the correct CPT is 46261. These are some of the important topics in the digestive system along with the respective portions. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.